hospital's empty this morning. Of course it would be. It's Sunday at 4:30 a.m. All right, hospital 2. Gotta enjoy the sunlight when you get it, because when you're on call and you are stuck inside the hospital, you may not see the sun the entire day. So it's a Sunday. So the good thing about being on call on the weekend is you don't have any other responsibilities. We don't have clinic, we don't have ORs running, depending on the day. Today we actually do have some stuff going, but your responsibility is just to take care of everything on call, which is nice. The most hectic time when you're on call is when you're coming on call in the morning and when you're coming off call. You have to get sign out, you have to pre-round on patients, so it's really hectic. So I've just traveled between 3 different hospitals between 4:30 and 7 a.m. trying to do a bunch of stuff. So my call shift hasn't even really started yet. So about to head to get breakfast. Haven't been paged yet, so we'll see how it goes. Hospital 3. Hospitals on the weekend are like a ghost town. Such a nice view. All right, so finished morning rounds. Had to go to 3 different hospitals, check on all our inpatients, make sure I'm up to date on everything that's going on. So I am about to go back to the second hospital because I have to see 2 patients. I got 2 consults. Got an abscess and I got a laceration, like a big one. So gonna have to close that, figure that out. It's gonna be a long day. So I saw my 2 consults. We have a really big laceration we're gonna take to the OR to close. So just kind of waiting on availability for that. Then another abscess. Like, one of the most annoying things when you're on call is it's not really the amount of consults you get, especially on face. It's just the logistics and things that go along with it. So if you have a consult, it's getting set up, you know, maybe nurses having to get things for you, the ED being ready for you, right, having to write notes. So like the procedures in and of itself aren't that big a challenge, but it's when you have all this other stuff. So a lot of times you just end up sitting around doing nothing and waiting, which can be very annoying at 2 a.m. in the morning when you want to be sleeping. So like during the day, early in the morning when you have energy, all this stuff is fine. And then you get paged at 2 a.m. and you don't get to do whatever you want to do until 4. So hopefully that doesn't happen. But one of the things you need to do, especially if you are, you know, doing surgery or any kind of procedure, is you really want to read up on what you're about to do. And this was something I learned early on in intern years. Don't just do stuff just to do stuff. You really need to know what you're doing. So looking at the anatomy, what nerves are in the area, what blood supply, all that kind of stuff. Supratrochlear, supraorbital, you have auriculotemporal, so the nerve supply to the scalp. So just reviewing all that stuff and just making sure you know what you're anesthetizing and what you need to avoid. So should be a fun repair. All right, just waiting outside the OR. Going to roll the patient back soon. I can do this lac. I got 2 pending consults waiting for me at another hospital, so I need to get this over with quick. Lacs on the scalp can be very tricky because it's highly vascularized and so it bleeds a lot. You have to make sure you get good hemostasis. That's really important. Good hemostasis with everything you're doing so you can see and you are able to close it properly. But we'll get this done and then move on to the next thing. It's already like, what is it, 1 o'clock? The day's just gone by so quickly, and like we're not even halfway done yet. So it's a maze back here to try and find anything. I just need a headlight. All right, so just finished up in the operating room We had an IND and some extractions. And then we also had a really big laceration. Two things that like you can easily repair. It doesn't take a lot of time, but like I started at 1, it's now 6. And the reason it took so long is because turnover for rooms, when you're on call on the weekend, there's limited availability for like anesthesiologists, things like that. Getting the patient down, like just so many things, having to write your notes. It's so slow. So I have 6 consults I have to see now. I don't know how I'm gonna get through it all, but I gotta get through it all before rounds. And I'm probably gonna get more, so we'll see how it goes. Luckily one of them is in this hospital right now, so I'm gonna go see it in the ED and then run over to the other 2 hospitals. So we'll see how it goes. All right, finally leaving. It is almost 7. I have to head to 2 hospitals. I have 2 consults at one, and then I have like 5 at another one. So I'm not gonna sleep tonight, unfortunately. We just had another fracture come in. I had to admit a patient. So we'll see how the rest of this night goes. I'm really hungry. When you're on call, you burn through like calories, and I haven't eaten all day, so I need to actually I have snacks with me, so I should be good. All right, let me just go drive to this hospital. I'll see you guys when I get there. I'm going to the 12th floor. All right, so I finished that laceration, and now I'm gonna go to see another consult for a ZMC fracture, then head to the other hospital, see an abscess, see an orbital floor fracture, see a scalp laceration, and then there's something else. But slowly catching up. It's about to be 9 p.m., so we can do this. And just like that, it's dark outside. All right, so I'm in the workroom. I have to get a bunch of supplies. I have a LAC I gotta do, and then I have an IND I need to do for I haven't actually seen the patient, so it might be a vestibi, it might be something else, so we'll see. Whenever you have caries, you can have an infection that ends up breaking through the bone and then causes an abscess. We have to drain it so it doesn't get worse. So that's like one of the things we get the most is that. So yeah, slowly catching up on everything I need to get done. Almost there. Not even close. It's only 9 o'clock. Y'all, I still have not left this hospital. So we had a dislocated jaw. We had 2 lacerations. What else we have? I have to run back to our 3rd hospital. Got another consult there. Another dislocated jaw. So we'll see. This is why I go to the gym, so I can force jaws back into place. We'll see if I can do it. All right. I don't even know. What time is it? It's like 12. What am I even looking for? I don't even know what I'm looking for. I came into this clean workroom to... Oh, tape. I need tape. Okay. All right, guys. This is so annoying. I got a ticket. Do all this work for the hospital. You help them out. You're parked in the ED. You're here all day, and they give you a ticket. Great. All right, reduce the mandible dislocation. I have another consult at this hospital. I've seen the patient, and I want to get it done, but it's going to take a while to set up, so I'm going to go see the other patient waiting for me at another hospital and then come back here. It's, what, like 2 a.m.-ish, something around there, so getting there. Yeah, and I'm also very upset about that ticket. That kind of ruined my entire call shift. Make sure there are no rats out here. I'm just playing, there aren't rats. Or at least I haven't seen any. All right, I'm sitting in my car. I have these like Cheeto things. This is the only thing I've eaten. They're not even good. I thought they'd be tasty, they're not good. Yeah, I don't like them. Morning rounds. Pre-rounding is lonely. right, so this is a call room. You got your computer, chair, nice bed that is very uncomfortable. You got your sink, shower, and the toilet. So unfortunately for me, I was not able to use this call room because I was running around at many different places. But if I was on a call shift that wasn't super busy, I would probably set up shop here and just have some downtime, study, do whatever you want to do. So, all right, so call shift is over. It is, I think it's almost 9. So I got paged, basically, all right, so let's debrief a little bit. So I got paged at, 3 a.m., 4 a.m., 5 a.m., for different things at 2 hour at one hospital, one was at another. Problem was, I was at one hospital and I finished a procedure, and then I had another patient waiting on me at another hospital. So I wanted to just go see them because they had to set up for the third patient at the same hospital I was at. So I had to go back and forth, and then I had to pre-round, and then I got paged again and I had to go back to the first hospital. Are you guys still following? But just basically, whenever you're on call, it's not very straightforward sometimes, where you have responsibilities at 3 hospitals, and sometimes it's going to be where all your consults are at one hospital, and that's great. Sometimes it's going to be where you're going between many of them. And so a lot of call is just you driving, or you walking, or you just trying to get to a place, and it's just a lot. Like, I was on my feet because I woke up at what time, 4 a.m. or something, and it's now 9 a.m. the next day. So I haven't slept. I still have energy, but I just know that as soon as I hit the bed, I'm gonna crash, which is gonna be nice because I don't have to do anything really today. But yeah, let's just talk a little bit about call. So I have my call bag. It's like a little small bag that has a bunch of stuff that I need. So stitches, 15 blades. We have different types of sutures. You have your 4-0 monocryl, your 3-0 chromic gut. I have a syringe. I have a bunch of stuff. Rhino rocket. This is something you put up patients' noses to stop bleeding, place pressure in the nose. So there's a lot of different things in here. And then, I don't know, for some reason I have this, sometimes we use a red rubber catheter to help patients to be able to drink fluids after we do surgery, because oftentimes they're wired shut. So this helps them to get fluids. I just have one just in case we need it. I have a 5-hour energy. I actually never even used it. And then I have this OMS reference guide, which is basically all residents get it from, I believe it's from RO-AMIS, the resident association, or it might be from AMIS itself, but basically it just has basics about different procedures, drugs, anything really. And so it's a nice guide when you're on call, just to, if you don't know, just look it up in the book, and it's nice to have on you. So I have that. But yeah, I'd say so far my time in residency has been good. This was probably top 3 hardest shifts, just because of like not having any sleep, which is normal, but just the sheer amount of stuff I had to do on top of taking care of our inpatients, right? So, but it was good. Whenever you're on facial trauma, you learn a lot about yourself. You learn about what you can handle. You learn that you can handle a lot. So going through this shift now, I always do a little debrief with myself. What did I learn? What are some things I need to improve on? So definitely need to improve on my suturing, just getting faster, just reading a lot more about infections and just trauma in general. Like there's so many different types of fractures you can have in your face, right? So what type of fracture is operable? Like are we gonna do an open reduction, internal fixation? Is this something we need to do closed? You know, there's some things for sure that are standard that everybody kind of learns in the first week, but then you'll get these random things like, well, in this scenario, should we do this? The person is this age. So you have to really read and get experience, but that comes over time. That's why my residency is 6 years. So that's it for the call shift. Thank you guys for coming along. I want to show an actual real life, what is an OMFS resident's first year trauma call like. sometimes I see these videos and everybody just comes out looking pretty. They got their makeup on, or guys got their hair and they look great. My beard is messed up. I haven't showered in 24 hours. My lips are dry. I can barely keep my eyes open. That's how you feel after a call shift. It's not like all rosy. So, I mean, I could have made it seem that way, but all right. So I'll see you guys in the next video. There'll definitely be more of these. Make sure you like, share this with somebody. If there's somebody in dental school, somebody in med school, share it with them. Leave some comments and I'll try and get to them in a timely manner. So I'll see you guys in the next video.